The GHA's public meetings aim to listen to the public and take their concerns on board. Director General Patrick Geoghegan believes this has been achieved. Speaking to GBC after a lively debate during questions and answers, he said the feedback was invaluable to change, adding, "It's okay to disagree."
In a way, I do like these sessions because sometimes you can go and no one asks a question or so kind of passive. You often think, am I having any impact? And I think if people are getting hot under the collar, they're passionate about something. And sometimes by being passionate about it, then I go away and I look, have we got it right? Have we got it wrong? You know, if what they're saying, did we make a mistake?
Let's give some sort of context into this. It was actually about the balance between cost effectiveness and medication. Yes. Of course, both, I imagine, are important.
I think both are important. I mean, you can't have one without the other. And of course, we don't have finite kind of resources here, so we have to spend our money wisely. And we will spend that money on our patients. But then we have to make sure that where we can make some savings, because sometimes we are prescribing very expensive drugs which we don't need to prescribe. We can get generic ones. But can I assure the public as well, and I know people tonight were very irate with me, some of them, quite rightly, talk with your GP, talk with your doctors. We do not want anyone to be in pain without the right treatment.
One of the issues raised was the lack of a mortuary at the hospital. This is part of our culture, and Dr. Geoghegan gave assurances that it was in hand.
I've heard from the people of Gibraltar. People have come to see me on a number of occasions asking me about the mortuary. I wasn't here when the mortuary was closed, I think, during the COVID period. But there's been a really strong message from the public. We want something back. We want to be with our loved ones. We don't want to be kind of just in and out. So I've had part of our estate strategy. We've looked around the hospital. We've designated an area where we'll be able to create at least 2 viewing rooms. It's not finalised yet, but we will be announcing it quite soon. But we will have a presence back again in St Bernard's Hospital.
And innovations coming on stream. Primary care at the Children's Health Centre, announced by the Chief Minister in his New Year message, is expected to be operational in early March, with GPs, including a paediatrician, and its own dedicated phone line. There are improvements in the pipeline for ENT services. Reviews have taken place in the community dental service, in orthopaedics and in maternity. The 5-year National Dementia Strategy is to be announced in February.
We'll have a new dementia coordinator. We're involving people, carers who are looking after people with dementia. They're our advisors on the committee. So I certainly hope we're reaching out to some of the most vulnerable people in our society and saying, come to us for help.
Announced yesterday is a patient's voice group, established to be the public's voice and ears.
This is real people out there in Gibraltar, 12 people, who are going to tell us what it's really like. They're going to speak to patients, they're going to visit our wards, visit our departments, and they will come back and say, do you know what? You are doing a good job. You might think you're doing a good job, but you're not doing a good job. And people don't like the food, or people love the food, or people are well cared for, or people are not well cared for. Because I've done it all my career. I learn from listening to people. And I'm a service user, as you know now with my cancer, I'm a service user. I feel sorry for the people looking after me because I will be the one pestering them. But that's important, that the real people who use our service say the good, the bad and the ugly.
The next public meeting will focus on mental health.